Hi everyone, I'm Ayush Sharma, co-founder of Aartas CliniShare. So if you try to understand the primary reason why the cost of healthcare is going up, if you see nowadays there's a lot of advancement that is happening in the field of medicine with a lot of technology coming into the picture and how we are developing technology. It comes at a cost. There are people like back when I was at US training at Mayo Clinic, we used to spend a lot of time in researching and coming up with new things and then working on them. So all that investment that was going into the research, eventually when we came up with a successful product and launched it into the market, it comes at a cost. Yes, we agree that that cost is for the benefit of the patient, but at the same time, it needs to be recovered by the companies. And I think that's the primary reason the cost is going up. Now, let's say we take an example like MRI. When we had MRI introduced, it was meant for good high resolution images of our human body so that we can do better diagnosis. Now with time we started increasing the resolution after doing a lot of research, and we realized that we can do better and better. And you see today now we are adding artificial intelligence, AI models to the MRI for better diagnosis. At the end of the day, all this work that is being done at the back end does increase the cost, and there is an investment that goes into it. So this is the fundamental reason why cost of healthcare, especially diagnosis, is going up in recent times. I think another reason why the cost is going up is because our focus from primary and preventive care has gone to super specialty care. And this also comes because there is a demand from the population. And we see that the hospitals, they're trying to get the latest infrastructure and they're investing in that, which all comes at a cost. Now, if we see these hospitals, when they are trying to, they do invest in the infrastructure, but then they have to recover the cost as well. The third reason for the cost going up is doctors are now practicing defensive medicine. What does that mean? There is an inherent fear that if I do something and now if I miss something, tomorrow the patient can come and sue me and my degree or all my effort could go down the drain. I'll give you an example. Usually when a patient comes in, walks into the OPD and says that I have a headache, the first instance is you try to find out the reason of the headache and give some medicines. But nowadays you are afraid that, oh, this could be an underlying tumor, so let's just get a CT or an MRI done and just rule it out, so that tomorrow if it happens to be, then at least I'm safe. That eventually, that extra investigation that we are adding now is also increasing the cost. Now we see robotics coming into the picture in the field of surgery. Initially it had started as simple robotics who used to be an assistant to the surgeon. But nowadays they are able to do complicated surgeries as well. And all this advancement is coming at a cost because robots are very expensive. With increasing technology, we are also adding artificial intelligence into these robots, which are adding more to the patient outcomes. So all this advancement that we are doing in medicine is coming at a cost to the patient. I think insurance plays a very critical role in this. Like today you walk into a hospital, the first thing they're going to ask you is your mode of payment. They're not worried what disease you have. They're saying whether you're going to pay via insurance or it's going to be out of pocket. Yes, they are trying to secure themselves and that does help in giving unbiased care. But definitely it comes at a cost, and overall it could increase the expenditure of healthcare. I think our government has done a fantastic job with Ayushman Bharat, which is insurance for all. What that does actually is it decreases the threshold of a patient to go and visit their doctor to get care, which eventually helps in preventing complicated diseases and inpatients and decreasing the overall cost of the healthcare. I think what we need to have is more preventive healthcare and primary healthcare combined with specialty healthcare, but in a leaner model where the infrastructure burden is not there on the doctors, and so that they can give unbiased opinions. And I think government is already doing a fantastic job with this, having more centers where you can get access to better care at a lower cost. So if you see our hospitals today, they are actually overburdened with so much crowd, which is adding to a lot of dissatisfaction from the patient's point of view. At the same time, is causing burnout and fatigue in the doctors who are treating them. And if you see traditionally, hospitals are actually meant for advanced treatment, but they are also tailoring to outpatient departments where these patients are coming and just doing regular visits with the doctors. which in that all crowd and chaos does not help either of them. So we need to think of more leaner models where the outpatient setting is taken out from the hospital, where they can focus more on inpatient services and high quality care, while doctors in a more relaxed environment can deliver outpatient care to the patients. So while I was studying in US and I was practicing in US, I saw very different healthcare that compared to India. Especially when I was at Mayo Clinic, what we saw was integrative, collaborative care, where multiple doctors from different specialties are working together for the best patient outcome. And I always felt this is something that we lack in India. While most of these places were driven by Indian doctors and they were doing excellent over there, what we realized was there was a lack of environment in our country, which because of which the doctors couldn't deliver that kind of care. So we started working on an idea, and we broke down our healthcare system, and we came up with an idea where what if we make the doctor independent, take out all the burdens so that they can focus on the care and provide an environment where it's more collaborative and they work together for the best patient outcome. And I think that's where the idea of CliniShare was born in 2019. On day one, they can actually, without any investment, start their own independent brand and focus on the care, because that's what the doctor's job is, to focus on the care. At the same time, for the patients, we are trying to provide the most seamless experience and have the most advanced technology where they can get their OPD care, that is outpatient care, in a much more cleaner and nicer environment. So we opened our first CliniShare on Ring Road, South Delhi. And within a year, we had tremendous response from the community, both doctors as well as the patients. We have over 35 super specialists right now at this location, and we are just opening another one on Golf Course Road, Gurugram. Idea is by end of the year, we'll cover Delhi NCR and then move to Mumbai. In next 3 years, our vision is to open 100 such centers across India and build the largest network of private practice doctors.